Good morning, everybody.
Good morning.
You did it for me. I literally
morning.
had good morning. Welcome to the Medicare Cafe pre-chat, where we log on just a few minutes early, and sometimes we answer questions that you have, and sometimes we talk about our dogs and filthy children.
And the mower. Can you hear the mower?
Yes. So we are going to deal with the mower this morning, which if you live in the Midwest or like anywhere, I don't know how allergies outside of the Midwest work.
I know my sister really struggles in Texas.
In Texas, ooh, everything is bigger. But if you are like me and your environment is trying to kill you, we're just all gonna take all the Zyrtec. I bet every like pharmacy thinks I'm on a list because I'm getting all like the behind the pharmacy like Sudafeds. I'm on a list for meth
my
making.
gosh, you take the Sudafeds?
Oh yeah, I have to. They're good. It's that good.
Oh my gosh. I feel like I remember
heart's
taking
doing this.
Sudafeds. I was gonna say my heart was like pounding out of my chest. I remember the last time I took
that
Sudafeds.
plus like the 5 cups of coffee I had. I am on
I
a whirlwind.
I would be dead.
I smell colors.
If I did that.
Listen, it's the
Me
price
and
that I
caffeine
pay.
don't go well together.
So you're not a caffeine girly?
I gave it up a year ago in May, almost a year,
I kind of remember that.
because I was having like a bunch of weird heart stuff going on.
Yeah, I remember that. I will not. That is one thing I will not give up.
I love coffee so much, though I still have a cup of decaf.
I can appreciate that. There was
It's more of the experience, you know.
holding
just
on to a
holding the
cup.
mug.
There is something that like I saw a trivia question. It was like, what's the number one reason why people drink caffeine or coffee? And it was like energy, socializing, the taste, and something else. And like the number one
Holding
answer
the
was
cup.
taste. And I'm like, most people
hate
hate
the
the
taste, I feel
taste,
like.
right? And that's why they doctor it all up. But yeah,
Huh.
they said the number one reason people drink coffee is because of the taste. And I think I'm like a habitual drinker. Like, yeah, like I could, whenever I was pregnant, I gave up drinking. I did not give up coffee. I couldn't.
I hope you gave up drinking while you were
I
pregnant.
did. Listen, it was a struggle. No, well, kind of. It was during COVID.
I didn't
So,
give
like,
up coffee.
So, like, everybody during COVID was my pregnancy. So, good news, no one saw me got fat, and I got to just, like, exist in quarantine in my house. However, everybody was like, oh, my gosh, it's quarantine. So, like, we're all playing these drinking games. Like, my family would FaceTime each other, and we would play drinking games, like, at our houses. And I was like, this is a great time.
So interesting. So my mom's side of the family is Italian, and my aunt, we just had this conversation because she just went and visited some family we have in Italy, and there's 2 distant cousins that are pregnant, and you know they have wine with like every meal, and they they drink their whole pregnancy wine.
Yeah. That's what I mean. Like the doctors always say,
yeah, I've heard like
have
a glass of
have
wine.
a glass, all that stuff. Yeah,
It's just crazy to me.
The smart one's back. We did miss Carrie. We missed our
The
Carrie.
smart one. Ooh,
Carrie was.
my brain feels like mush right now.
Oh my God, mine too, because of my environment's trying to kill me. But Carrie was last week. You were at not last week. The week before last. You were at
Charleston.
because you write so much business.
Oh.
So you got to go to Charleston.
I did. It was lovely. First vacation in 4 years since becoming a mom. So it was long overdue, and I got to actually see my husband again. We didn't
nice.
feel
Did you guys like reintroduce yourself to each other? Like, hi, I'm Carrie.
Yes. I was like, what is this? Are we talking?
We're gonna talk and
Gosh.
stuff. Wild. Last week I got to see a lot of you guys. So if you saw me, you reached out to Medicare Con.
I do have to say one thing real fast.
I
we
love
get
it.
there, and Glenn was like, where's Olivia? Like, I really was looking forward to spending time. Like, her husband seemed really cool.
Oh,
here.
I'm sorry. I was at Medicare Con, which I honestly, it was fun. I hate Vegas. Like, I'm going to be the and I didn't hide my dislike for Vegas.
You didn't hide it.
I didn't hide it. If you talk to me, probably the first thing I said is, oh my God, it's so good to see you again, or so good to meet you. I hate it here. But it was a great conference. I really enjoyed getting to see a lot of you guys, get to meet you guys, give lots of hugs, and again, just lots of, like, it's fun when the cafe family gets together. So really enjoyed that.
Good.
I would have loved to be in Charleston, but
I would have someday.
Vegas is a close
Go to
second.
Hawaii next year.
I have a surprise. So we'll talk about that later. But listen, welcome to Medicare Cafe. Today we are talking about holy industry changes. I did not put the Batman on there, but I can tell you, like, I love my team. Holy industry changes, Batman.
Weed eaters out.
Weed eaters out. Oh, it reminds me of like the dentist.
I
Like
love
the
the dentist, so I would go there every week if I could.
What, the dentist?
Oh, I love the dentist.
Oh, do you floss in real life, or are you
Like
floss?
3 times a day.
Yeah, you teacher's pet.
I just like it.
No.
I like it.
Absolutely not. I haven't been to the dentist in a year and a half, and I know it's bad. I'm going to go. I'm not a flosser unless it's the dance move. So why are we talking about the industry changes? We actually got a visit by mom and dad at Integrity last week, and just kind of talking about what's going on in the industry. What are we doing? Like, what are we going to see this year? And guys,
And I'm scared for this.
This year, there's 3 things.
No, that's my bread and butter up there.
Yeah, there are 3 things that we need to talk about. Medicare Supplements.
Scared? Do you need to hold my hand?
A little bit. I'm probably maybe a little. The latest ruling and what we know so far, and then AEP Madness about like. Long story short, guys, AEP prep starts today. That's what I'm doing with our agent resources team, is talking about like we need to make sure we're ready for AEP, because it is going to be just a sneak peek. Normal years, they expect between about a 10 to 15% of clients like shopping and moving plans. 75% this year.
Why?
We'll talk about it. But they're expecting 75% shopping rate this year. It will be an AEP that we haven't seen since before 2012. Not in my time.
What's the like data telling them this?
We'll talk about it.
Okay.
We'll talk about it. So let's start out first with the Medicare supplements. So we did a Medicare Cafe on this last month. I tried to find the exact date, but YouTube was like, girl, try. But about a month ago, we did a Medicare Cafe on Medicare supplements. And just understanding, like right now you mentioned, like some Medicare supplement companies are coming out with like 20% rate increases. Yep. Guys, that's the new norm with Medicare supplements. So as we know, again, watch that episode of Medicare Cafe to get into the details about what's going on with Medicare supplements. But Medicare supplements have been vastly underpriced since I've been here. When we see like inflation rates, healthcare prices, what happened with COVID, the rise of not illnesses, but the rise of claims, the T65 market is now the number 1 cause of loss ratios. They're the most expensive book of business to have as a T65ers, the younger generation, which is a complete flip than what it used to be, which ultimately, and then Medicare supplement premiums have not kept up with the inflations. Yeah. They have not seen massive rate increases. So now we're going to see some, I'm not going to say overcompensating, I think some deserved compensating for the last 10 years of not a lot of MedSup disruption. So the mid-teen rate increases that we're getting accustomed to, looking at ACE at like 12%, other companies, United Healthcare is coming in at 12%, some carriers coming at 15%. That's the new norm. That is what we're going to see, and I don't see that. That's not just like a this year, let's get caught up. We're going to see this for the foreseeable future on the MedSup side. So what that means is that your Medicare supplement clients are going to need to be sold based off the value of that plan. Sure. You can't just say, it's going to be, and we're going to see the Medicare Advantage market, guys, it's on a frenzy this year. It's not going to look at all this time next year what it is like. That's not going to be at all the same this time next year. What? So to say like, all my MedSup clients are going to move to an Advantage plan because of these rate increases, maybe not.
Oh, like a bad frenzy?
A frenzy. Not a good frenzy. It depends on how well prepared, if it's going to be a good frenzy or a bad frenzy. If you're very well prepared, you're going to have an amazing AEP.
I'm prepared. She's preparing us today.
If you prepare for AEP the way that you've always prepared for AEP, you are going to lose your ass. And I mean that. I mean that in the best way.
Keep talking. I'm just gonna sit here and watch you.
Well, no, it was an alarming conversation for me to have on Thursday. Being like, we knew this, we had speculations, but like to see the data, I was like, oh.
So did it have anything to do with? I saw an article and I can't remember. I was trying to think of it. Beakers, breakers. I don't remember who posted it.
Oh, yeah. So there was Mutual of Omaha had a big scandal where a lot of people were fraud. It was fraud. They were basically saying,
No, it was that
Mutual of Omaha wasn't fraudulent. Providers were fraudulent, and Mutual of Omaha was one of the biggest carriers hit by that. But go ahead.
That for the first time, like the government's come out ahead in these Medicare Advantage plans, but that for the first time ever, Medicare actually lost money to the Medicare Advantage plans or something.
We'll talk about it. So that is something that's happening. Again, all the investments, but we'll talk about like how that is going to affect the plans here in a second.
Okay.
That's not what's causing a lot of this.
Okay.
It's contributing, but it's not what's causing it.
Okay.
So anyways, your MedSup market, just a reminder when you're coming to your Medicare supplements, again, I talked in detail about this about a month ago, so go back and watch that episode. The biggest thing, though, is just the fact that like when you're talking to your clients, I'll say this, your MedSup versus Medicare Advantage presentation will have to look different. Why you choose a MedSup versus why you choose a Medicare Advantage is going to look different this AEP and moving forward.
Curious.
So we'll build trainings on that. Every single time we do a MedSup versus Medicare, we do it quarterly. We do that webinar quarterly. It's a little different every time. It's going to be even more different this year. So just when you're selling Medicare supplements, you need to make sure you're not selling premium. You're not selling like, you're really selling like, this is peace of mind. This is a more expensive product because you have more peace of mind. You have less work. This is a convenience product. That's what the value of it. So it is going to be more expensive and it's going to continue to get more expensive.
You know what I've had more and more clients ask me, and I've started saying it sometimes, is they've asked me, which ones are my doctors going to like? Which ones do the doctors like? And I'm like, they like the supplement.
Absolutely.
Doctors
and that's
like
not going to
this.
change.
That's
That's
easy
actually
for them. It's streamlined.
That's going to continue. So that's a really great, like, your doctors will like this, but it's going to cost you more.
Yeah.
You have less concern, go wherever you want, all this stuff, but you are going to be paying a price for that, and that price is going to continue to go up and up. So it's going to look
I just liked that phrasing of, which is going to make my doctors happy, which one pays my doctors better, which one do they like.
So big point. Let's get into the latest rules. I'm not going to go too in depth in the final ruling because I have here again so far, because there is a period. Usually that period is about 3 to 5 days where people can comment and give explanation. The final ruling came out about 3 weeks ago. It was about 4 weeks ago now. It was a over 1,300 page document. Here, usually you get about 2 or 3 days to make comment on it, and then they come out with the true final rule. This time they give like 6 weeks. So that's why I'm saying like this is what we have so far, but there are some clarifying things.
Does Shaylin read those 1,300 pages?
Every word on the 1,300 pages. Plus, we're really incredibly fortunate that we have integrity in our arsenal.
Pocket.
Yeah. So integrity has an entire team of legal who break this down every which way, look at every loophole, look at everything. So like Shaylin and them get together, they have these discussions, and then we get the benefit from that. So here in about 3 or 4 more weeks, or actually probably less than that, 2 to 3 more weeks, we will be receiving about a 30-page document with the true final ruling and just some clarifications on what's going on. Now, what everybody paid attention to in the final ruling was overrides. Will FMOs be able to be part of the process? It is the general consensus. All of this is going to depend on like how the carriers, because carriers are the ones who enforce CMS regulations. So all of this will come down to how carriers view this. But it's everybody's interpretation right now that overrides are fine. None of that's being affected. But there were some significant changes on there that people really didn't pay attention to because they were so worried about where the money's coming from. So overrides, again, this is just a initial comment. More is going to come out later. Overrides, but like things like your AHIP getting paid for by the carriers, co-op, marketing dollars, our carriers paying for your seminars, a lot of that stuff is on the chopping block. So like be prepared to pay full price for it's all about follow the money. If they're saying if United Healthcare pays for your AHIP, then you might be more inclined to write United Healthcare, even if it's not the plan that best suits your clients. So money will look different this year. What your FMO can do for you will look different this year. If you're somebody who's like, I get a bonus per app that I have right now, that's what my FMO does for me. That's going to look different this year.
So does that include the HA bonuses?
The HRAs, that's, again, I don't want to talk too much on it because they're still not 100%. There's still clarifying things going on, but that's on the chopping block as well. Any money, so basically Medicare Advantage plans got a $100 raise on your commissions. Anything above that's not allowed.
Wait, the commissions are
Yes.
raising, but the HSAs and other stuff
Everything
is
else is going away because they're saying like you should be able to do your own marketing, have your own technology with $100 a month raise. We're going to give that to you to compensate for not doing the HRAs, not doing the VBEs, not doing the AJs, not doing co-op.
But
not
don't
doing
the
anything
HAs help them with like statistics and like better?
It helps the carriers.
Yeah.
And the carriers, again, like they got a little outrageous. Carriers were paying $125 for a consumer to take a test. So,
Yeah.
or for a consumer to answer a survey. It just, again, money did get a little out of hand. And so this is CMS's way to kind of say like, no, we're leveling the playing field to where I don't want you to write, I'll just pick on carriers like WellCare. Their DSNP HRA was $125. I don't want you to write a WellCare DSNP because you get an extra $125 if the Aetna DSNP is better for that client who only gives you $75. So that's where like they're trying to just lay the playing field and make it truly about the consumer. So that's happening.
I can get on board with that. I get it.
The biggest things though that people aren't really paying attention to is the dual eligible market and lead generation.
Okay.
So just an update with the dual market. This is the last year that we will have just an open SEP for the dual eligibles. What's going to happen next year is going to be treated like 5-star plans. If you are working with an individual who is a dual eligible client and they are not currently in a dual eligible plan, they will have one election per year to get into a dual eligible plan. Right now, the way the SEP works is that you have one SEP per quarter, go on any plan you want. No matter what, you get one per quarter minus AEP. This one is going to work just like 5-star or like chronic conditions. You get an SEP to enroll into a chronic condition if one's available. So they'll
basically have 2 a year.
They will have 2 a year if they're not already on a DSNP plan.
So if they're already on a DSNP, it's just AEP.
Just AEP. So that's going to look a little different. Your DSNP marketing will look a little bit different.
I feel like I need to be taking notes.
I can send this to you. Or you can watch it. Just watch it. So
No, I'm not going to rewatch myself.
No.
Won't do that.
I do it every once in a while when I'm like, I had a bad episode. Like I performed poorly, so then I'll rewatch it and take notes on myself.
I haven't ever watched.
With a bottle of whiskey. I hate watching them, yeah. But anyways, so the DSNP market is going to look very different next year. That's significant. Yeah, you just don't have a free range to enroll them whenever you want. And then, of course, the lead generation is going to look really different this year. There's a lot of people out on this still. So none of this is like true, like final. It's all like this is what they propose, or not propose. It's not proposed. It's final. But they're answering questions about what does it mean and coming out for clarification in 30 days.
Brian, so you must watch a lot then.
Oh, Brian.
You've had that episode.
Surviving is, it's I self-medicate.
The DSNP will hurt some consumers.
Absolutely, the DSNP will hurt consumers, yeah. It's all about education. That's what ultimately what this all comes down to. We'll talk about that. Like, what do we do now? We'll come
to make AEP even that much crazier.
75% shopping rate compared to the 10 to 15 or 10 to 12 what we're used to. It's gonna be nuts. So, and then last but not least, lead generation this year. So starting for business or for products for a January 1st effective date, so October 1st is what we're seeing so far, knowing that you will no longer be able to just buy age leads. You won't be able to buy, basically, TPMO to TPMO, which is like a lead vendor to you sale, will no longer exist unless it's customized. So for you to be like, I want to do a mail drop or something like that, which again, mail drops are struggling, but this year mail drops may actually perform really, really well because everybody's shopping this year and looking for information. So this might be the year where lead generation is really hot. Figure that out now. But I need a drink. My mouth is very dry and the allergies are winning. Okay. But in order for you to be able to do a lead drop, purchase leads, whatever the case may be, that lead has to be customized for that agent. So it has to have that agent's name, that title, everything. So whenever, like right now, when you want to do a lead drop, you send out a bunch of mailers. It's just this generic thing, and then the lead company knows to put those leads back into you.
That could ultimately be better, though, if it's customized to you.
Well,
right?
higher closing rates because people actually know what they're looking at.
Yeah.
Lower return rates, potentially, because people know that it's an advertisement, and raising of costs. Because right now,
it's easy to just
do that. But whenever I have to customize it for you, that's more admin work for me. So really, and keeping in mind programs like Lead Center, where you can go on there and buy like on-demand style leads, won't exist.
So it's just going away. Won't exist.
Lead Center will exist because Lead Center is actually ahead of the game. They've been doing on like campaigns for the last 2 years to where they do customized campaigns for their agents, and you can create your own campaigns within Lead Center, but the on-demand style leads will no longer exist. So it's very, very important that that we learn how to market ourselves, cultivate our own leads, get more familiar with different types of lead generation.
Strategic alliances. Yep.
Because lead generation like mailers you may see a higher return this AEP than we've seen in a long time because people are hungry for the knowledge this AEP with 75% shopping rate, but the client acquisition cost is going to be much higher.
William asked, have they ever changed their rules based upon public comment that opposed it?
This year is different across all boards. And understanding that public comment, that part's already done. The public comment stuff happened ended January 5th. And it was up until about 4 weeks ago when we actually got like what resulted from that public comment. What's happening now is that lobbyists and Integrity, American for Beneficiaries Choice, they're asking clarifying questions as far as like when you say TPMO, define that. So they're asking, defining, and getting answers on. So this is the rule. What does that mean? But at the end of the day, interpretation is based on the carrier's interpretation because they're ultimately the ones that police it. They're ultimately the ones that that enforce it. Thank you. So we are still waiting for the clarifications that should be out in the next couple weeks, and we're waiting to hear what the carriers have to say about it. Man. So that's just the final ruling. That's just big takeaways. Be your own TPMO. Learn how to generate your own leads. Learn how to do your own client acquisitions because it's about to get really expensive. We can talk about that as much as you guys want. And then the decent field is going to look
totally different
next year. So make hay while the sun shines this year.
I mean, surely they'll get back to us, like you, not us. Like, I just feel like there was a lot of stuff down to the wire last year.
Oh, and it will continue to be. And I'll tell you,
that's really frustrating.
And I'll tell you what else is going to be down to the wire next year. We're not going to know plan benefits until close to October 1st. Let me talk about why. Let's talk about AEP.
So how can we prep?
Let's talk about AEP Madness. So there's a few things here that are kind of going to contribute to
add
AEP
the election
Madness
on there because I've already this week I've had 2 people talk about it. Two this week.
This is just about like the industry, let alone like what the world does.
Right.
Which is anytime there's an election, it's really hard for your messaging to stand out. Scare tactics gets used. This year will be a huge year to talk about Medicare in the election. So
the Inflation Reduction Act is going to make things
90%. That's dramatic. A majority of percent of everything that we're going to see this AEP is a direct result of the Inflation Reduction Act. Mm-hmm. So keeping in mind, the Inflation Reduction Act, then the significant things, of course, started back in 2020 or 2021 where we saw $35 insulins get in, saw some updates last year with the LAS and all the things that's been changing with that or did change with that. This year is when they're going to enact the $2,000 maximum out-of-pocket on prescription drugs.
I don't like it. Just saying.
It's,
I can tell you my theory if I haven't already.
On paper, it's like great. You won't pay you only pay $2,000 on your drug when before people were paying $8,700 on their drugs a year.
If those drugs are on the formulary.
Yes.
All these expensive drugs are going to be off the formulary and therefore clients are going to be paying more for drugs.
Clients are going to be paying more for drugs. They're going to have to find alternatives to prescription drug plans to pay for some of these medications.
I'm sweating.
And they're expecting the average premium to jump up. Again, this is based on depth research. I'm actually sitting in on a webinar at 1 o'clock, so I'll even have more updates after this to go about like what depth.
Part D premium?
Part D premium is going to be going up between $60 and $70. The average premium is going to be somewhere between $60 and $70.
Totally expected.
As well as fewer drugs on the formulary.
As well as MedSups.
Medicare supplements are going up. And keep in mind, we've already seen Mutual of Omaha pull out of the PDP space. A lot of those carriers that are only a lot of carriers that only do prescription drug plans and are not in the MA space or not strong in the MA space, you can expect to see them I think we'll continue to see carriers say,
if their premiums are increasing, will their commissions increase at all?
No. Commissions are going to be stagnant. So, yeah. So the Inflation Reduction Act, again, because they're putting this cap on it, and they're expecting the carriers to just eat that money because of the cap, which these are for-profit organizations. They're, knowing that there's going to be more legislation coming down the pike that will limit rate increases, will limit things like that. So they're getting them in as they can, this AEP. So significant.
Well, and the 10 drugs that are being negotiated.
Mm-hmm. Yes.
Like if there's a cap now, like what's even the point of that? Like,
we will have to see. Just knowing that, again, so PDPs are going to be a lot.
So many.
So here's the problem with that. You are going to have to, as an agent.
But it'll affect MAs.
It will. Well, yeah, we'll talk about that. But if you do have a larger MedSup book of business, you got a lot of PDP clients on the books.
Yeah.
We need to make sure, this is MA too, but we have to make sure that you are not spending your entire AEP writing and comparing and helping clients shop for your lowest paying product.
Yeah. I don't know. How do I avoid that?
We'll talk about it. We're actually coming up with game plans as we speak. We're hoping to be able to hand out AEP packets. But before I get to solutions, let's talk a little bit more about the Medicare Advantage market. Should I see every... So
yeah, I mean, I'm thinking of like 300 PDPs.
Let me tell you this, and I want I want you to be scared, because you cannot go into this AEP like you went into last AEP.
Yeah,
you can't. So you need to be a little uncomfortable with this. I will tell you though, agents who are prepared will have the best AEP of their life. Agents,
my type A will be prepared.
Agents who have adopted technology, agents who have adopted unique selling styles, agents who are building their name, agents who start prepping now, you will have the best AEP of your life.
Yeah.
If you treat this AEP like you did last year, the best you're going to do is retain your book of business, and it's likely you'll be losing to call centers.
Not going to be me.
Not going to be you. So
even with all my PDPs, not going to happen.
Yeah. So what's going on with the Medicare Advantage market? Obviously, Inflation Reduction Act, but we got a little bit of background of like what's going on with this. So the carriers are feeling this too. They're having to compensate for the Inflation Reduction Act. They also, for the second year in a row, got their funding cut from them versus like more and more funding to the carriers. They got less funding this year than they did last year.
Repeat that. Who got less funding?
All the carriers.
All the carriers.
Yes.
From Medicare.
From Medicare.
Because of
several different things. A lot of it being what you talked about, that Medicare Advantage benefits have just gotten crazy. We saw, like, for example, Aetna Medicare Advantage. They got a slap on the wrist because they were willing to pay for camping equipment, tents, shoes, things like that. And now CMS is saying you can't do that.
So those will all go away?
You just can't submit those anymore. You can submit things for, like, exercise equipment. They didn't say anything about the golf. But, like, if you're doing it for, like, camping equipment, shoes, things like that, you cannot submit those for reimbursement with Aetna anymore. CMS is paying really close attention to how carriers are using these benefits. Yeah. Another drink.
Do you anticipate enhancements to the PPO-style Advantage plans to counter the adjustments to the MedSups? Sounds like no, really.
Here's what I expect for the MA side. It will be all over the place. It will be... chaos. Some plans you'll absolutely see an enhance. Some plans they will just completely fall off. You will see more plans introduced this year, new plans introduced this year to capture more market share. This year, clients, because of course inflation, I've said it a few times, this year they're expecting a 75% of people shopping compared to the 12 that they've seen in the past.
12.
So another reason for this, obviously the Inflation Reduction Act is going to cause these plans to take a serious look about where they're investing their benefits. Are they going to continue to do the Part B givebacks? Are they continue to do that much dental? Are they going to continue to do,
They can't be if their reimbursement is less.
We will see. Some plans are dedicated because that Part B reimbursement gives them a lot of business. However, it is 100% utilization. So you might see more investments in things that have less utilization. We won't know. And here's why we won't know what plans are doing until closer to October 1st. So we know that plans will release, and like here in the next couple weeks, they actually have to submit their 2025 benefits to CMS. When they do that, We'll usually hear back from them in June, July, and they show us what we know as sneak peeks. This is what the plans will probably look like going into this AEP. Previous AEP prep, what we do is we study those sneak peeks, see what companies are going to be competitive where, see where their edges are, and based on what product we're going to sell the most off of that. This year will look completely different. So in the past, once they release the sneak peeks, CMS will then give them sometimes more money afterwards to say, okay, here is an X amount of dollars. You need to improve these benefits. You need to take away from there. So the sneak peeks aren't really what's going to happen, but they're pretty dang close. This year, the rebids, last year was $10, $14. This year they're expecting, and like the carriers freaked out. What are we going to do with all this money? That much money per member per plan. This year they're expecting almost a $100 rebid amount, up to, or in some cases exceeding that. So they were freaking out about $14. They're getting 8 times that amount.
I'm so confused. So they're paying them less, but they're going to
they got the initial cut. So they're basing the benefits of that.
Significant amount
and then
more.
Once they submit that, then they're going to give them the money for
and
the
rebid is just what happens between
June and October 1st.
Why would they give them money to reevaluate it? So there's going to be significant changes then.
Yes. Hence why I'm saying you won't
Don't pay attention to those sneak peeks.
Well, not necessarily. What the sneak peeks are going to tell us this year are where those plans want to be. Where are they going to be aggressive at?
What
it's
new
not
plans are.
What new plans are going to be releasing, where do they want to be competitive, but it's not going to tell you which plan you're going to write more of. And here's the thing. Here's another thing that we see. Because carriers are going to have to start getting really creative, because we kind of saw like Medicare Advantage plans kind of became a race to the bottom, right? Like who's going to have the lowest premium, highest, lowest MOOP, all that. Like they were kind of all the same, with just maybe a little touch here and there of like what was the extent. This year, we're expecting to see mass differences between these Medicare Advantage plans. You might have some that mirror a Medicare supplement, just cheaper. So higher premiums, or, like we actually saw a huge in
How
Illinois.
could it mirror a supplement?
So in Chicago, Illinois, we saw this. I think the Blue Cross plan had like a $90 or like $100 premium. It was a Medicare Advantage plan, but like 0 copays, 0 deductibles, like really, really high rich benefit plan. But it had a premium. It was Medicare Advantage plan with a premium. So it's basically kind of like a MedSup Select, which is like a networked MedSup. Kind of the same thing, but really, really affordable.
Interesting.
So you might see plans that have higher premiums, but lower maximum out-of-pockets. You might see plans that have no premiums, really rich benefits, but you're going to pay a ton of money if you have to go to the doctor. It's just going to require a lot more fact-finding. If your clients want to stick with a Medicare Advantage plan, you're gonna have to know specifically why they wanted a Medicare Advantage plan. Was it because they were comfortable with networks? Was it because of the bells and whistles? Was it because of the low premiums? Because they're gonna have a lot more options.
So basically, I'm gonna have a ton of trial rights, is what I'm expecting.
OEP is gonna be hopping.
I don't
next
know.
Year. OEP is gonna be hopping. I think you might see a lot of people leave Medicare Advantage plans because the thing that they were afraid of this plan looks great this year, next year is going to turn to trash, will happen in a lot of cases. So you might have a lot of people want to go back to Medicare supplements.
It's a 48-hour rule. I'm getting in bed from my office. 48-hour
rule is still in effect, will continue to be in effect. So just keeping that in mind as well. But we've said this for years. If you may not have to see all of your clients, but if your clients don't hear from you, it's likely they will move.
Yeah, for sure.
That is 100% the case this year. And it is very possible, because we don't know what the plans are going to look like. It is very possible that we will have, that the plans will do crazy, crazy things, and these plans will go down in benefits or up in premium, all this stuff. But the clients want to stay on it because there's nothing else better for them. So you might do all this work and they not move. Just for them to feel comfortable.
Does the rebid process happen with PDPs too? Like, is there or will the sneak peeks? I feel like we don't really, do we get sneak peeks?
Carriers don't give two craps about PDPs because it's a retention product. It's not, they don't even give sneak peeks on PDPs. No one talks about PDPs.
Yeah.
And so
but with a $60 to $70 premium hike, I'm gonna want to know in advance.
I think you're gonna see a lot of carriers say peace out to the drug market. I really think so, because it's not a money making thing for them anyways. They don't like to do it. They don't advertise it. They don't want it. Now they're going to lose money on drug plans. I can see that happening. Smell, care, don't care.
Will call recordings still be a thing?
Call recordings, but reminder right now, call recordings is only on marketing calls, basically not a current client. If you're cold calling or prospecting, that's the only time call recording. And if you're doing an over the phone or non-belly button to belly button sale. If you are selling and not even like talking benefits, if you are going to collect an application and you're not face-to-face, that call needs to be recorded. Mm-hmm. So those rules did kind of calm down after last year.
Can you talk a little bit about RetireFlow?
Yeah, I'd like to talk about RetireFlow. Long story short, when it comes to, before we get into RetireFlow, because it kind of is going to fit into this, what are we going to do this AEP? It's all about your preparation starts now. You need to be so familiar with Medicare Center and Lead Center. You need to have your advertising starting now. People need to be building, not advertising towards AEP, but advertising. There will be a need more than ever for true experts, your systems and your processes. If your AEP appointment is more than 30 minutes, we need to get that 30 minutes down to 15 minutes in a lot of cases. But if your AEP appointments are more than 30 minutes, you will not survive this AEP, quite literally. So we need to figure out like things that we're seeing a lot of agents doing, Anoch meetings, to where like if you can do group appointments, like a formal sales appointment or a formal sales event where you sit down if you have everybody with this United Healthcare plan, do a meeting and go over the changes of that plan, get that done. And if they want to change, using Plan Enroll to send them a new application and getting rid of those appointments, I'm telling you, systems, processes, and technology will win this AEP.
Do those really work, Anoch meetings? Because I just feel like you can only talk about that plan changes. You still can't do an individual like review with them.
I will tell you, one of our biggest agencies located in Washington, Missouri, they were one of the top United Healthcare producers in the nation. 100% Anoch meetings. That's what they do. Because their book of business is too big to meet with everybody individually. So they'll have a meeting. If you are on this plan, come to this meeting. We'll tell you what your plan looks like for next year. And in the past, it's been, if you want to change, set up an appointment with me. We'll change. We'll go over everything. If you don't want to change, then stay put. You don't have to do anything. Don't answer the phone. Don't talk to anybody else. You don't have to. If you're okay with these changes, don't do anything. This year, you're really going to have to make sure that you get your clients' drug list well before September, getting those drug lists, and updates as soon as you can, making sure that you train your clients to know, like, if you have a change in drug or change in provider, call me immediately, keeping those up to date. Again, it's going to be Medicare Center is going to make or break your AEP this year. Being able to not have to be face-to-face to a client, especially with those drug plans, just being like, I will email you the drug plan you need to be on. If your drug list is correct, if all of this is correct, I will email you the plan you need to be on. Eliminate your PDP, because you are going to spend more time on PDP appointments this year, and it's your lowest commissioned product. Still wildly important, more important this year than it's ever been. But you've got to find a way to eliminate those appointments.
So you can just, and I'm embarrassed to ask this, when you say send them the enrollment, like they fill it out?
Nope. What you do on Medicare Center is that you fill out the application. Of course, like you do that. You can text them or email them a link, and they just sign it.
Okay, yeah.
And
so that's what I do.
So you fill it out, You do all that. You fill it out. You text it to them.
I thought you were saying send them the Plan Enroll. And I was thinking like they do it.
No.
Okay.
So Plan Enroll does have two functions. Number one is that you can send them their link and they can do their own shopping, review their own drugs, enroll themselves in a plan that's completely unassisted, doesn't require a scope appointment because you're actually never talking to them about the plan. But if you are going to actually advise them and tell them what plan to enroll on, you fill out the application, text it to them, they sign it from their phone, and it's done. You never have an appointment.
Oh, William, do you think that the discount pharmacies will take up the slack on off the formulary meds? I am a huge, in every single one of my meetings, I talk about our pharmacy here, NextRx. I send, it's more than 50% of my clients use them because it's significantly cheaper.
And keeps you out of the donut hole.
There's like 5 drugs that are estradiol. I just had a client who, it was usually like $40-some on her plan. She went to the pharmacy and they said we had to use a different drug manufacturer, whatever, it's $200 for this month. And she was like, no.
Yeah.
She called me. And so her pharmacy wanted to charge her $200 for 1 month's supply of estradiol. NextRx had it $23 for a 6-month supply.
That's
$23 for a 6-month
supply. That's not. It's
both came from the same McKesson distributor.
We will have to be creative when it comes to paying. So like CleverRx, NextRx, which is again those discount pharmacies. We're gonna have to get creative. Needymeds.org is a thing that I use in the past where you just type in the medications and it tells you if there's any coupons for it or if there's any programs on it for that, so that they don't have to use their prescription drug plan. You might be talking to a lot of people this year who they don't have any prescriptions and this plan became an $80 plan. Yeah, I'm just not going to have a prescription drug plan, which I'm not suggesting. I don't think that's wise because they'll have the discount and who knows what medications you'll get prescribed later in life. But
check your text.
You'll have a lot. Yeah, sorry. Good call.
Michelle, NextRx, yes, it's a pharmacy. NextRx is here in town, but in Columbia, but they have like a $5 shipping anywhere in Missouri, Kansas, and Illinois, Nebraska. I forget all their states. $5 shipping. And because they're regulated differently, they don't have the same PBMs. They can send like 6 months supply at a time.
Get creative with drug saving. So Brad said,
I also have an 11 I have to be at.
Okay. Sorry. Yeah, we'll wrap up here in a second. Brad was asking again about the DSNP market, DSNP changes. Brad, long story short, DSNP is going to basically switch to like a 5-star plan SEP to where it's not one per quarter. It's you have one per year and it has to be to enroll into a DSNP plan. So you can watch the recording of this to kind of talk about how we got there. But the DSNP SEPs will change in 2025. So again, going into this AEP prep now, what we usually do to prep is figuring out, look at the carriers, look at what they're going to say, look at what the benefits look like. That'll be the last thing you do this year. You may not even be able to get that until October 1st. Like that, you probably won't get that until October 1st. We usually don't, but it's not been that big of a deal in the past. So what carriers you're going to write is the last thing you need to worry about this year. You need to make sure that your portfolio is set up, that you have Devoted, Essence, United Healthcare, you have Anthem, Humana, Cigna. You have to have all of them this year. You do. And it sucks, and I don't like that for you, but you have to because the one you don't get is the one that's going to be popular. Call us to get that set up. You're going to have to be more educated on technology, systems, and processes than you've ever been, and you're going to have to set the expectation for your client that, hey, I don't know that I won't have the opportunity to meet you more than 30 minutes. Plan your OEP. Know your OEP is going to be hectic as well. This is scary. It should be scary. You should be really uncomfortable. We are working today to make sure you are set up and strolling into AEP. Like, we actually have several meetings. I'm actually on a new committee. Several meetings going on about what are we doing? What are we giving somebody, an agent this year to say, here's your AEP? Because everything will look different. So stay up to date. Stay on Medicare Cafe. Make sure you're paying attention to news coming out from senior marketing specialists because we are working constantly on. We got a lot of these updates on Thursday. We are doing a ton to figure out what are we going to do to set you up for success. Because again, if you treat this AEP like you have in the past, you're going to have a bad time. But if you are prepared, you have your systems and processes, you have your technology, you can make out like a bandit this year. You can keep your clients and you can gain hundreds of clients because people are going to be actively looking for agents. Just make sure you're set up to take them.
Somebody asked about LIS. I imagine that would still be affected.
LIS, yeah. I mean, it's the same thing, same SEP. But reminder, LIS levels don't exist anymore. It's all or nothing as far as somebody getting help paying for their drugs. So keep that in mind. So somebody asked about RetireFlow. So RetireFlow is a company that I've come to be really good friends with, really like, because I'm a systems processes. How do I get stuff off my plate?
Yep,
how do I
efficient.
what's worth my time? And asking for scope of appointments, permission to contact, drug list, doctor information. That's stuff that's things that doesn't require my expertise. That's just information I need to have. So that's what RetireFlow does. RetireFlow is a link that you can either email, or text your clients with, and it uses the same information flow is like CMS. It is HIPAA compliant. It is secure. But your client goes in there and they put in their drug list. So like it'll auto-populate just like Medicare Center does. So like most likely prescribed. If there's a generic, it does basically just like if you're using Medicare Center. But it also collects a scope appointment. It also collects permission to contact. And it gives you a nice little database to where all that information is. So that during AEP, you're not constantly reaching out, trying to get drug lists from people. You send them the link. And
Remind me how early we can collect a scope for AEP.
12 months.
So I can start sending my scopes
today.
Now.
Yes. But just keeping in mind that like if you have an appointment between now and AEP, that scope is no longer good.
Yeah.
So you can start collecting scope appointments now. A question that I'm getting.
For sure.
Yeah. A question that I'm getting is I've had several times. When should we start collecting drug lists? It depends on how well your clients are trained.
Yeah.
If your clients are trained to know I have a change in health condition or I have a change in medication, I need to call my agent, then go ahead and start collecting them now, right? And just knowing like, hey, if anything changes.
Yep.
If maybe your clients are not so good about maybe calling their insurance agents the last thing on their mind whenever they get a new diagnosis or a new medication, then you might want to wait closer to July, August to start collecting those because of those changes. Always, 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 regardless of if the clients put the information in themselves or whatever, or if, you've updated those, always just confirm at the time of the appointment that that drug list is up to date. So
I'm going to have my first Anoch meeting this year.
Let me help you.
I'm going to do it.
Anoch.
I have a huge I don't have a huge portion of MA people, but they're pretty much all United Healthcare. So that could
you need to do Anoch meetings. Yeah, 100%. And what you do with these Anoch meetings is say if you have any friends or family that are questions about their plan, if they're on this plan or not on this plan, doesn't matter. Bring them with you. And it's just a registered sales event, so it is a CMS. You have to be CMS compliant, but it's easy. So easy.
I'm doing it.
Okay.
I'm going to plan it.
Do Anoch meetings for the love of God. Even if you don't have anybody, on that plan, do formal sales events and try to get all the appointments done at once.
I have probably more than 10 seminars already scheduled for August and September. Will I need to do anything different for my seminars?
No. The final ruling didn't really affect seminars. Same rules as always for seminars. But yeah, just remember you can't do Anoch meetings until after October 1st.
Right.
So William says I'm not getting much sleep at night. Guys, it's a mindset. You know the
we're gonna have
40
a leg
agents,
up on everybody.
The 40 agents who watched this presentation today, you have a leg up the thousands of agents that didn't. And that's not me being conceited. That's me saying we just got this information. You guys are the first people I'm telling.
Because I'm sure no one else at my
company you have a leg up, and you know more than 98% of agents out there. Yeah. Start prepping today.
We're gonna rule the AEP world. If 40 agents.
I'm telling you, if you do that, you will have the best AEP of your life. It'll be hard. You will work your ass off, but you'll be going to Hawaii in January.
Yes.
In
January.
Well, I mean, just so you know, we'll be going in March. But January. We will. So you will have the best AEP if you do it right. And I'm being very serious right now, and I'm pointing, but it's because don't be scared. Be excited. Be uncomfortable.
Don't be scared. Be prepared.
Fire safety. Okay, I know you have an 11 o'clock. Any other questions, comments, concerns, threats, or promises? Yes, appointments can be done via Zoom. Just make sure that you're recording it. If you're doing a sales presentation and you're not belly to belly, the audio at least has to be recorded. Any other questions, comments, concerns, threats, or promises, let me know. Work with our team. I don't want everybody to go scared and leave the industry because you guys can
Let's have a part 2 of this. And we've done in the meantime.
I will be talking about this constantly, giving you guys tools and resources. We're creating videos for agents to use, like Anoch videos that you guys can use and say, like, prepare, some client-facing materials. We're making a ton of client-facing stuff right now. You can make the most money you've ever made. And I know that's not why we're here. We're here to help clients. It's just awesome that 75% of people are going to be begging for help. You get to help them, and you get to make a lot of money doing it.
I like it.
Awesome, guys. Awesome. So be ready. And you guys know this. We have, 6 months before AEP. May, June, July, August, September,
5.
October.
Yeah.
5 months before October 1st. So you guys got plenty of time. Anox will still go out towards the end of September. Yes. I haven't at least heard of that changing.
Yeah.
But become friendly with your carrier reps now because they are wonderful at helping with Anoch meetings. So become friendly now. Get to know them now.
Putting that on my list too.
Yeah. Awesome. All right, guys. So until next time, have fun.
Make money
And give